So we're going to Skype in Dr. Charles Town, one of the participants in this maxi course. What could you tell me about him? So he represents a younger dentist that wants to go to get the credentialing.
Absolutely. Now, Dr. Town is a younger dentist practicing in Texas, and he wants to provide implant services for his patients. He wants to get out of the realm where he's only putting the crown or cap or bridge on top of the implant. He wants a better understanding of when you need to put an implant, what's the best treatment plan. He needs to quarterback the case versus relying on a surgical specialist to quarterback the case who only understands the surgical aspect of it. So he wants a more comprehensive understanding of implant dentistry.
Okay, great. Dr. Town, welcome to the program.
Thank you for having me.
Now, Dr. Town, so for patients that are watching this, why pick a dentist that's been through the training at the American Academy of Implant Dentistry?
Well, I can tell you from my own personal experience, partially through this course, that it's been an amazing experience that provides me a comprehensive knowledge of implant dentistry. And I feel like it's something that I really needed to have, and this is what I've been looking for, and I'm really glad that I joined the program.
So what's your take on the advantage where you both, that you do the surgery on the implant and you also do the restorative part or put the tooth on top?
Yes, sir.
For the patients that are watching this, what's the advantage having one guy doing both parts? Or is there an advantage?
Well, there's a huge advantage to having a dentist that will actually place the implant and restore it for the patient. And a lot of advantages come in that whenever the implant's placed, the restorative part is also planned before the implant is placed. So it's great to see the planning involved from actually going from the crown to the actual implant that's being placed and making sure everything is lining up correctly.
So 300 hours of training, is there really that much to learn?
There's so much involved in implant dentistry that I had no idea that I was actually needing to learn until I started taking this course. And I'm very appreciative of the fact that we have this course. So the main thing that is beneficial about this course also is that when the dentist is placing the implant and restoring the same implant, he or she is a part of that process from start to finish. And so that way the case can be planned correctly and restored ideally, instead of having an implant that is maybe tilted the wrong angle or not at the right location, and then all of a sudden restoring that implant, which is what the patient really wanted the whole time. Is they don't care about what size implant you place, what type of implant you place. They want to know when they can get their tooth back. That's all they care about. So having a dentist that can do all parts of that from start to finish is hugely beneficial.
So I'd like to add to what he just said. A patient should look for the credentials of an American Academy of Implant Dentistry fellow, associate fellow, or even a diplomat when they're choosing a dentist. They'll know that that doctor had the right training to provide the proper care for the patient.
Okay, but the challenge is always that the patients, they're not going to remember these initials.
Yes.
They're not going to know, how do I know if my dentist is qualified? So how do they know?
They have to ask their dentist, or they can go to the website. You'll see credentials on the website. You'll want to find out what they are. You can go to the American Academy of Implant Dentistry.com. It's not hard to remember. AAID.com. And on there's a list of all the credentialed members throughout the United States.
Okay, and Dr. Town, will you be listing this on your website? And would you be offended if a patient said, what are your credentials? And how often does that even come up? They probably don't even ask, do they?
I will be listing this on my website whenever I do complete the program, and I wouldn't be offended at all if a patient asked me if I had enough training to do what we're recommending. It's a very valid question. Someone's going to put an implant in someone's mouth, and they really need to know if that doctor has had enough exposure and training in that field to do that correctly.
Okay, Dr. Town, thank you for coming on the program.
Thank you so much.